Hi, I'm Dr. Ben Newman. I'm a coronavirus researcher with 20 some years experience researching these viruses. And we'll try to answer your questions. So, we'll do two at the same time because I see there are two next to each other that are similar. So, one is from Kimberly. Let's see, I had my third Pfizer dose in August. Is the booster different than the dose? Good question. And the second is from Victoria. Hello. And let's see. Miss Victoria asks, what happens if you get the booster and get COVID at the same time? Is the booster still effective? Interesting question. Yeah. Yeah. So let's get into it. We'll do the Kimberly question first. So Pfizer. So in the case of Pfizer, the adult dose is the same for a booster as for any of the other doses. So the amount is 30 micrograms. You get 30 with Pfizer. Just think of it that way. And yeah, that's for each dose. I think even when they're using the fourth dose of Pfizer in Israel, I think that is also still a 30 microgram dose. So that's a level that they're comfortable with, provides a decent amount of immunity, and it sure does. So good for them. Yeah. Let's see. If you're getting a different vaccine, so the other one that's approved for boosters, at least in some places, is Moderna. And with Moderna, the booster is half a dose. But with Moderna, you get 100 micrograms to start with. And so when I say I'm glad I got Moderna, and you get a little bit higher immune response against Moderna, like better antibody levels, it's because there's more RNA in the Moderna shot. There's about 3 times as much. Yeah. 100 instead of 30. Yeah. I realize that's imprecise math. Yeah. The Moderna booster is only 50. So a Moderna booster is still more than you would get from a Pfizer single shot. Yeah. There's not a giant difference between these two, and overall they're both pretty effective. And I say I would have been fine getting the Pfizer booster after a Moderna. Yeah, it's just that the pharmacy that we go to is a Moderna pharmacy, so whatever. That's their choice, not my choice, but it works out just fine. And they're the closest ones, so we're lazy, and that's how a lot of things get done in the world, I think. The children's dose of Pfizer is, I'm assuming you're not like 15 years old, but the children's dose of Pfizer for the 5 to 12 age group is a third of a regular dose. So that's only 10. So 10 for kids, 30 for adults with Pfizer. Moderna, 100 for adults, and 50 for a booster. Yeah. So the answer is yes, but as with everything else, it depends on exactly which one we're talking about. But yeah, in your case, that's it. Second part of this from Victoria. Yeah, interesting. What happens if you get COVID while you've got the booster? There is no body of literature on this at all. So all we can do is speculate. So what do we know about coronavirus? So these things have quite a few anti-immune defenses. Basically, somewhere between a third and half of their proteins are shutting down some component of the immune response. But they're shutting down components of the immune response in the cell that the coronavirus is infecting. As far as I'm aware, anyway, they don't have a good way to shut down immune responses outside. They just prevent the sick cell from telling any of the rest of the immune system that it is sick, essentially. Yeah. Rounding off a couple of corners there. So, what you're talking about is things that are happening roughly at the same time in totally different cell populations, and they're responding to different things. And so, what I suspect is that you wouldn't really find much difference at all. There may be some sort of when cells get sick, or when cells break down, they do a lot of things that change the way the immune system works. So the immune system reacts to dead cells, dead your own cells in your body. It reacts predictably, in a kind of concerned way, which is what your immune system's for. If part of your body is dying, you want your immune system to at least go check it out, right? Yeah. some of those are going to be similar signals to the ones that immune cells will use to. We're we're rounding off so many corners. But the ones that immune cells will use to talk to each other. And so potentially you would get sort of a simulation of kind of increased effectiveness. So the other part of this is that with most vaccines, or many kinds of vaccines, they will put in a thing called an adjuvant. I don't believe there's a specific adjuvant added to either of the mRNA vaccines, but I think there might be to some of the protein and protein vaccines. Anyway, the point of an adjuvant is that it is there to generate these non-specific kind of, they used to call them danger signals back when danger theory was a thing. And so this does make it more likely that you make a strong immune response. And so it may be, we're going to get sciencey, but it may be that the viral infection would act as a weak adjuvant of some sort to make the vaccine more effective. That's, I think, the most likely thing, that, or maybe the most likely thing is the two are unrelated and nothing happens. But if something happens, I suspect that would be the thing that happens. I don't know that there is a good case for why a coronavirus infection would make response to any vaccine, including a COVID vaccine or a flu vaccine or whatever, less effective if they're both being processed by the immune system around the same time. You could argue that maybe you're presenting too many different antigens to the immune system. Like it's trying to do too many things at the same time, but there are a lot of cells in the immune system, like a ridiculous number of cells that are at least peripherally involved. And I don't know that just with two things that would actually fly. So we know that you can vaccinate against 4 different strains of human papillomavirus at a time and get really good protection. And the normal flu vaccine goes against 4 different strains of flu, which are all basically being processed at the same time by the immune system. And you get good immunity to all 4. So I don't see why, if 4 is possible, I don't see why 2 is not possible. You get, yeah. I hope that makes sense. So yeah, I think you're okay. And if you were feeling a little under the weather from the vaccine side effects, it may be hard to tell that from coronavirus. And I would say the thing to do there is to do one of those tests, either the at-home or if there's somewhere around you where they can do a little PCR swab or a saliva test. They work really well, and you don't have to put the stick up your nose. Yeah. I don't know why we are so fixated on the stick up your nose thing, which is more like a flu test. It's not materially better, and it is materially more annoying and just, it feels weird and unpleasant. Yeah. I don't know, but that's people for you. Yeah. We start doing a thing, and darn it, we're going to do the thing until we can't do the thing anymore. So there you go. That's hopefully a decent answer to both of your questions. Thanks very much, and this has been Ask Dr. Ben.